This brief overview is designed for physicians and advanced practitioners who want a reliable way to prepare platelet-rich plasma at the point of care. Tropocells PRP is an FDA 510(k) cleared Class II device that concentrates platelets from autologous blood using a patented gel separation tube, giving you a consistent way to prepare PRP when you decide it is clinically appropriate. The focus is on what makes this system practical, reproducible, and straightforward to integrate into a busy clinic. The Tropocells system is designed to standardize PRP preparation using a specially treated glass tube with a patented gel separator. Blood is drawn directly into this tube, and with a single centrifugation step, the gel forms a barrier between the different blood components, allowing the platelet-rich plasma layer to be isolated from red blood cells and most granulocytes in one closed system process. According to manufacturer data, this process yields approximately 80% of the platelets from the original blood sample, while eliminating about 99.9% of red blood cells and roughly 92 to 96% of neutrophils. The resulting PRP is both red cell poor and neutrophil poor, and is described as monocyte rich. Over 80% of white blood cells in the PRP layer are monocytes, while still preserving lymphocytes. For you as a treating clinician, this means the PRP you prepare with Tropocells has a more defined and reproducible cellular profile than a simple whole blood injection or a basic spin that does not effectively separate out red cells and neutrophils. The device gives you a consistent way to concentrate platelets and beneficial mononuclear cells while reducing components that manufacturers and many investigators consider less desirable in PRP preparations, all within a single spin, point-of-care workflow. One of the most informative datasets for this type of PRP comes from real-world studies of knee osteoarthritis, in which PRP was prepared using the same separation technology marketed as Tropocells PRP in many regions and as MyCells in Japan. In a large observational series from a university hospital registry, investigators reported outcomes in over 2,000 patients, encompassing 2,815 knees treated with leukocyte-poor PRP, and found that average pain scores, on a visual analog scale, decreased from about 53.5 at baseline to 35.8 at 6 months, with roughly 60% of patients classified as responders based on predefined clinical criteria. The authors noted that benefit was more pronounced in patients with less severe deformity, and no serious treatment-related adverse events were reported in that cohort, supporting PRP as a generally safe option in that setting. Separate retrospective work from a European center, using a high-dose, neutrophil-depleted Tropocells PRP protocol for Kellgren-Lawrence grade 1 to 3 knee osteoarthritis, has also described a majority of patients showing clinically meaningful improvement over a 12-month follow-up, after a 3-injection regimen. These studies reflect outcomes in their specific populations and protocols and should be interpreted as part of the broader PRP literature. They do not guarantee individual patient results, and treatment decisions remain based on your clinical judgment and current labeling. The engineering focus behind Tropocells PRP is not only to reach a higher concentration factor, but to deliver a meaningful absolute platelet dose per preparation. Manufacturer and partner data show that when 322 milliliters Tropocells tubes are processed together, 66 milliliters of whole blood, the PRP fraction can contain an average of about 12.3 billion platelets concentrated into roughly 5.2 milliliters of plasma, reflecting more than 80% platelet recovery in that configuration. Building on this design, the new 40 milliliters Tropocells kit is configured to deliver a high platelet dose in a single, larger volume tube. This 40 milliliters format can provide up to approximately 10 billion platelets from one patient blood draw, with a PRP/plasma yield of up to about 24 milliliters, while maintaining the same single-spin workflow and neutrophil-poor, red cell-free, monocyte-rich profile that clinicians associate with Tropocells PRP. For practices, this means the option to reach a multi-billion platelet dose in one preparation, suitable for bilateral or multi-site treatment plans, without multiple venipunctures or changing the basic centrifugation protocol, allowing you to scale volume and dose within a familiar, validated system. Because preparation steps are defined and repeatable, Tropocells lends itself to standard operating procedures that can be taught and delegated under your supervision. The kit-based model creates a predictable per-procedure cost structure, which many practices find easier to manage than piece together supplies or send out lab services, especially when integrating PRP into an existing interventional or office-based service line. Please watch the following process summary video.
Begin by performing a standard venipuncture using the butterfly collection set supplied in the Tropocells PRP kit. Draw whole blood directly into the vacuum-filled Tropocells PRP tube. Immediately after collection, gently invert the tube about 10 times to mix the anticoagulant. Move to the centrifugation step by placing the PRP tube and a properly prepared balance tube into the transcend axis centrifuge, making sure the water level in the balance tube matches the blood level. Spin for 10 minutes at a speed of 1500 RCF. After centrifugation, gently remove the tube and place upright in the tube rack. The blood is now separated. Notice that the red blood cells and granulocytes are captured below the gel, and the desirable platelets are sitting just above the gel separator, with over 80% of the platelets directly above the gel. Next, insert the filtered vent needle into the airspace and attach the 65mm needle to a 10mm syringe. Slowly remove the PPP from the top down until you have the desired volume. You are now ready to collect the final product, platelet-rich plasma, or PRP. Attach the 41-micron filter disc to a new collection syringe and connect it to the extraction needle. Gently suspend the platelets by tilting the tube to about a 15-degree angle and slowly inverting it back and forth 10 to 15 times without turning it fully upside down. Then draw the PRP into the collection syringe. Remove the syringe, secure the cap, and place it on the tube rack until you are ready to use it.
It's easy to see from the process video that the Tropocells workflow is straightforward and can be integrated and delegated within a busy practice. The Tropocells PRP system is offered in multiple kit sizes, so you can match blood draw volume and PRP yield to your procedure and scheduling needs, including 11 milliliters and 22 milliliters kits that are widely used, as well as larger volume options, such as a 40 milliliters kit for cases where more PRP is desired. This range of formats lets you standardize on a single separation technology while choosing the kit size that best fits each procedure type, without changing your underlying protocol or equipment. Beyond providing the Tropocells PRP system itself, Transcend Biologics also helps your team build and maintain competency with structured online training and optional certification paths, so staff can perform PRP preparation and workflow in a consistent, repeatable way. You'll also have access to a practical marketing toolkit, including customizable patient materials, digital assets, and practice-facing resources that you can adapt within your own compliance framework to communicate clearly about PRP services. In addition, Transcend's loyalty program offers ongoing support and value-added resources for participating practices, rewarding sustained use of the system and helping you keep refining your PRP service line over time. Each loyalty point is equal to $1, and 50 loyalty points are automatically added to your account with your initial Transcend Success System order. Thank you for taking the time to watch this presentation. If you are considering PRP options for your practice, an easy next step is to schedule a brief, focused conversation with Transcend Biologics about how the Tropocells PRP system might align with your current workflows and service lines. In a short call, you can review your procedural needs and operational questions to help determine whether this 510(k) cleared PRP preparation system is an appropriate fit for your patients and your team. To request additional information, explore training opportunities, or discuss implementation details, please contact Transcend Biologics using the email, phone number, or website listed on this slide.